I was delighted to launch Leading Change, Adding Value in May 2016. It was a great start to the shared national implementation of our framework. And amazingly, when we live streamed, we had over 1,200 devices linked in. And through connections with Twitter and other social media, we had an estimated number of people participating of over 3.5 million. Key messages of the framework position nursing, midwifery and care staff as leaders, no matter what their role or wherever they work, and that really resonated strongly on the day. As did the principles of us identifying and addressing unwarranted variation. That is looking at what needs to change or how services can be improved, whether that be for the experience of our patients or for the individuals and populations that we care for. Of course, and as I witness on a regular basis, many colleagues already do this as part of their everyday practice. However, much of this essential work remains hidden and often misunderstood, and we don't easily capture it or measure it. So we need to look specifically at reducing that unwarranted variation, and where we find that standards of care are not equal and there are inequalities, how can we change them, and how can we ensure that everyone can receive the very best possible care? That has really struck a chord with the people that we are working with. I am therefore very pleased to be updating you on the fantastic work that has taken place so far as we've started to implement Leading Change, Adding Value. We have received several case studies of nursing, midwifery and care staff who have been identifying and addressing unwarranted variation in their very many different organisations. Their work shows how we can narrow those three gaps that we identified in the 5-year forward view. That is health and wellbeing, care and quality, and funding and efficiency. We've got examples such as the Exemplar Ward programme at UCLH in London, the Finch programme at Sandwell and West Birmingham Hospitals NHS Trust, and the fantastic Hot Potato project supporting mental health in young people in Cumbria. These and countless other examples are very great exemplars of demonstrating leading change, adding value in action. Leading change, adding value encourage us to apply the same importance to quantifying our work as we do to ensuring quality remains at the heart of all we do. The framework aims to help support us in truly considering the outcomes of our work and showcase the measurable positive difference that we achieve daily. The implementation of leading change, adding value is already starting to demonstrate and quantify our key part in the transformational change. Our professional contribution to the 5-year forward view and other initiatives such as All Our Health, Getting It Right First Time, NHS Right Care and other local, regional and national work will be set out and disseminated across the country. An atlas of shared learning and complementary research portfolio are currently being populated, and they will provide an interactive repository of over 200 case studies. Very clear examples of good practice and evidence-based practice. These case studies, translated into a mix of films and text, demonstrate leadership from nurses, midwives and care staff all across the country in different roles, different sectors and different organisations. They are all sharing the work on identifying unwanted variation and addressing how they've worked on that and implemented changes in practice. I'd like to thank you for all the work that you have progressed so far on Leading Change, Adding Value. I really do know how busy you are, and I thank you sincerely for the work that you do in often very challenging circumstances. And I want to flag up that the ways of working described in the framework are actually, for many of you, the way you work currently. It just is being described in a different language. So I'm asking for those of you who might have been hesitating as how you could put the framework in practice, look at Leading Change, Adding Value web pages, look at the examples that we've got, email the team, please share the excellent work that I know that you do every day and help add to our atlas of shared learning. Spread the fantastic practice that you do both nationally and internationally. Thank you very much again for everything that you do.